Hello ladies and gentlemen, welcome back to our ongoing series of lectures on anesthesiology. Today we are going to talk about pulse. We discuss in this lecture. Definition. Pulse points over major arteries. Purposes of taking pulse rate. Resting pulse points. If you are new on my channel, please subscribe to my channel, and also follow me on Instagram. So let's go to start our lecture. Pulse. Definition. It is the rate of heartbeats. Pulse is actually called heart rate, which is the number of time heart beats each minute. In some of types of cardiovascular disease, the heart beats and pulse rate can differ. Pulse points over major arteries. Superficial temporal artery. Common carotid artery. Brachial artery. Radial artery. Femoral artery. Popliteal artery. Posterior tibial artery. Dorsalis pedis artery. Purposes of taking pulse rate. To establish baseline data for subsequent evaluation. To identify whether the pulse rate is within normal range. To determine whether the pulse rhythm is regular and the pulse volume is appropriate. To determine the equality of corresponding peripheral pulses on each side of the body. Resting pulse rate. Age. Babies under 1 year. 100 to 160 beats per minute. 1 to 10 years. 70 to 120 beats per minute. Greater than 10 and adults. 60 to 100 beats per minute. Athletes. 40 to 60 beats per minute. Indications. Radial. Brachial. Carotid. Femoral. Popliteal. Dorsalis pedis. Posterior tibial. Abnormal pulse rate. Tachycardia. Sign and symptoms. Headache. Fatigue. Palpitations. Nausea. Hyperventilation. Sweating. Anxiety. Dizziness, vertigo. Sleep disturbance. Bradycardia. Symptomatic bradycardia. If a patient can't tolerate bradycardia, he may develop these signs and symptoms. Hypotension. Cool, clammy skin. Altered mental status. Blurred vision. Chest pain.